Now, let's consider some factors that cause an increased risk of developing PTSD. People who have a history of insomnia have an increased risk of PTSD. Now, even if a person does not have insomnia, if they sleep less than 6 hours a night, they have an increased risk of developing PTSD. A history of insomnia is a considerable risk, increased risk of developing PTSD. It is equivalent to combat exposure. That's pretty amazing. Lack of sleep causes more intense anxiety for even the person with a normal mental status. Now, another factor that causes increased risk to develop post-traumatic stress is poor nutrition. Poor nutrition decreases the melatonin in the brain, and therefore sleep is impoverished, and you have an increased risk of developing post-traumatic stress disorder. Poor nutrition would include excessive use of sugar, which is very common in our culture. It includes excessive use of high glycemic carbohydrates, that is potatoes, bread, things that convert quickly to sugar, McDonald's French fries, for example. Poor nutrition includes excessive use of omega-6 fatty acids, which comes from vegetable oils. These factors, when used excessively, adversely affect brain functioning and make a person more susceptible to developing PTSD. Now, when we send soldiers into war and we send Cokes, Red Bull, Red Devil, McDonald's along with them, and then we wonder why more soldiers are developing PTSD. Now, it's notable that caretakers have an increased risk of developing PTSD because they can witness or experience life-threatening events at any time. Now, people who've had PTSD for a longer period of time, for example, Vietnam veterans, are found to have twice the rate of heart disease, heart attacks, artery blockage than the average population, than the general population. PTSD is exhausting to live with. It's exhausting to live with feelings of terror, strong feelings of guilt, shame, self-hatred. And people who are living with these kinds of stressful feelings may conclude that suicide is the only way out for them. Now, if we consider the active duty military, one of them a day commits suicide, and that's about equivalent to the suicide rate in the general population. But if we look at military veterans, 1 hour commits suicide. That's 8,500 a year.